Is Allan DellaBella. I'm a chiropractic physician in Boca Raton, Florida, and today we are here to address the question, what is spinal decompression? Spinal decompression is a technique in where you use a manual or mechanical means to pull a disc back into its proper seat between the vertebra, as opposed to sitting against the spinal cord or against the spinal nerve root. This is a plastic representation of a spine, and here you can see the vertebra here and here with the disc here. Now this disc has the ability to slip backwards, therefore called a bulging disc, where it's putting pressure on either the nerve root or on the spinal cord itself. Over here we have a representation of a bulging disc. On the computer you can see the arrow is pointing towards the disc material that is bulging backwards. By using spinal decompression, you can suck that disc material back into its proper seat between the vertebrae. Madison, if you will come over to the table. There is a technique called the Cox technique that chiropractors use to pull the disc back in. In doing such, the doctor places the superior hand on the vertebra above the disc bulge. You then take the table and bend it just the right amount of distance to create a suction there. By doing this, we are sucking the disc material back in between the vertebra where it belongs. Now, there are different techniques to do this. There are many machines on the market now that are mimicking this. It's my opinion that the manual technique is the best technique because the doctor's hand is constantly on the patient's spine. The doctor is putting just the right amount of force and changing that force with each maneuver to adapt to what the body is changing and the way the musculature is changing its protection of that area. Now, the machines that are on the market now work by strapping the lower portion of the patient's body into a harness, and then the machine pulls it and lets it go and pulls it and lets it go. What I personally don't like about these machines, of this machinery, is that it's set on a particular force and it's constant as it's going. There's no doctor's presence to feel whether the machine needs to be increased up or increased down as far as the force factor goes. So in using the manual technique, the doctor can constantly change how much force is being applied. It's called the Cox technique. It's a very, very effective technique in pulling a bulging disc back, and it works with eliminating a lot of the pain from herniation also. So spinal decompression is a very effective means by which we can decrease or alleviate a disc bulge, or decrease the amount of pain from a herniated disc.